Carbon ion therapy is a type of radiotherapy for cancer. In external beam radiotherapy, high-energy radiation is directed at cancer cells from outside the body. Presently, the two most common external beam radiotherapies in use today are, on one hand, the conventional radiotherapy using X-rays or electron beams, and on the other, particle therapy using either proton therapy or carbon ion therapy, among others. At the Gunma University Hospital Medical Center, we use carbon ions for cancer therapy. So what exactly is the difference between X-rays and carbon ion beams? We asked Dr. Ono from Gunma University. Dr. Ono, what is the difference between X-rays and carbon ion beams?
There are two main differences. When X-ray pass through patient's body, X-rays affect a large area of healthy tissues. On the other hand, since carbon ion beam's effect is maximal only at the cancer region, the damaging effect to the normal tissue is lower than X-rays. This can be seen clearly in these images shown here, which belong to lung cancer and prostate cancer, and show how the radiation is distributed if they are treated either with conventional radiotherapy or carbon ion radiotherapy. Compared to the conventional radiotherapy pictures shown on the left, the right side pictures illustrate how the carbon ion beams concentrate the radiation to only the targeted cancer region, while minimizing the radiation to the surrounding healthy tissue. The second difference is X-ray radiation kills cancer cells by cutting a single strand of their DNA. The carbon ion beam, on the other hand, destroys cancer cells by damaging cancer DNA strand with a more concentrated effect. Overall, and considering the advantages we have shown, we can state that the carbon ion therapy is a more effective treatment than the conventional radiotherapy.
Examples of the strong effect of carbon ion beams can be seen in these images. Carbon ion therapy has succeeded in treating malignant melanomas and osteosarcomas, such as the ones shown within the red circles in these pictures. These types of cancer are particularly resistant to conventional radiotherapy and are not indicated for surgery either. These images, taken 5 years after the previous slide, show that the tumors have completely disappeared and also show that the patient recovered fully after the carbon ion therapy. To recapitulate, carbon ion therapy has shown several advantages over conventional X-ray radiotherapy, such as being able to better focus the effect of radiation to the targeted area, being more precise and effective in killing cancer cells, and having less side effects and more effectiveness for more different types of cancers. So, what types of cancers is carbon ion radiotherapy most effective against? And which cancers are not recommended to be treated by this type of therapy?
Carbon ion radiotherapy works particularly well against certain types of cancers that can be clearly targeted within a confined area, such as head and neck cancer, lung cancer, liver cancer, prostate cancer, and bone and soft tissue tumors.
Although carbon ion radiotherapy is an excellent treatment, it is not effective against all types of cancers. In cases of hematological cancers, such as leukemia, Systemic therapy like chemotherapy using anti-cancer drugs are more effective than carbon-ion radiotherapy because such cancers do not present a clear target. Carbon-ion radiotherapy is not effective for systemic cancers because it requires a well-defined localized target. For stomach and colon cancers, surgery is chosen over carbon-ion radiotherapy since such organs, constant movement is difficult to target, and also because the stomach and the gastrointestinal tract are more easily damaged by radiation. We do not use carbon-ion radiotherapy for cancers which can be cured well with other treatments. It is important to notice that while adverse effects of carbon-ion radiotherapy are generally milder than those of conventional radiotherapy, it is not true to say that there is no adverse effects at all. Adverse effects occur in the area where carbon-ion beams have been irradiated. Actual adverse effects differ depending on the area being treated. There are adverse effects which occur during or soon after the treatment, and those which occur months or years after the treatment. Please ask your physician for more detailed information on adverse effects. So, how is the carbon-ion radiotherapy actually performed? The whole process begins with the primary physician referring the cancer patient to our center for consultation and examination by our specialists in radiotherapy. This consultation will determine the suitability of the treatment. Once it is determined that carbon-ion radiotherapy is the appropriate treatment, it will take between 2 or 4 weeks of preparation where customized immobilization devices are made, CT for treatment planning is taken, and overall treatment rehearsal is performed. Actual treatment can last between 1 to 4 weeks. The treatment begins with the fabrication of an immobilization device so that the body of the patient will stay still during irradiation. Once the body is immobilized with the device, images of a CT scan are taken to plan the treatment. Every time the patient comes to a regular session, the patient's body is put in the exact same position for radiation treatment. During the carbon-ion radiotherapy session, the patient does not feel any pain or heat. After the treatment is over, periodic examinations using blood tests, CT, MRI, and PET scans are necessary to check the progress of the patient. It is also important to check if there are any side effects. There are many people involved in the treatment of patients at Gunma University Carbon-Ion Therapy Center facility. Now, we will introduce our staff to you a little bit further. Let's get to meet the people who make this therapy possible. The first person will be a physician, a radiation oncologist who is responsible for the overall treatment. The physician will evaluate and control the patient's condition throughout the process. Next, the patient will meet a nurse who will provide support to the patient during the different stages of treatment. Nurses will work closely with the patient and therefore will try to make the treatment as comfortable as possible. The radiation technologists, they are the ones who implement the daily therapy in the treatment rooms. Radiation technologists also perform tests, interact with patients and machines, and make immobilization devices. They take CT scans and carry out the treatment rehearsal. We then have the medical physicists who are specialists in the physics of carbon ion therapy. These medical physicists support the daily treatment behind the scenes. They calculate, for example, the dose of carbon ion beams and manage the accuracy of the treatments. Behind the scenes, we can also see the biological researchers who study the biological effects of the carbon ion beams. These biological researchers perform basic experiments using cancer cells in order to achieve standards of safety and effectiveness in the treatment. Localized in the adjacent hall, accelerator technicians control the carbon ion accelerator for safety and accuracy on a daily basis. And finally, we will introduce the administrative staff, who is in charge of running the treatment smoothly by managing all the administrative processes. The carbon ion beam treatment facility requires a rather large building, 65 by 45 meters, and a height of 20 meters, to allow room for the carbon ion synchrotron accelerator, the treatment rooms, and the administrative offices. Here we get an inside glimpse of the treatment facility. As you can see, a large highlighted area is dedicated to the treatment devices. After the carbon ions are generated, they begin their journey through a linear accelerator. In the synchrotron, these carbon ions are accelerated up to 70% of the speed of light. These carbon ions are then sent to the treatment rooms. In the treatment rooms, carbon ions are irradiated at the cancer of the patient. The main reception and waiting hall has been designed to provide patients with a comfortable and soothing atmosphere so that they can focus on their treatment. Everybody at Gunma University works day in and day out to provide the patients the best treatment possible, both mentally and physically, and to provide patients with hope for a better life.